In this podcast, I'm going to be talking specifically about one element of the ethnic rhinoplasty. There are so many things I could talk about, and as well as focusing on different types of ethnicities to Hispanic, Asian, African American, etc. Basically, the term ethnic rhinoplasty is a very broad term that encompasses all ethnicities other than white. So it is not very descriptive in many respects, but there are some commonalities in certain ethnicities that are not white. Basically, it's oftentimes a thicker skin envelope and a thinner framework. In other words, the cartilages are a little bit thinner, flimsier, not as strong. And this combination of thick skin and thin cartilage can also exist in Caucasians or whites. So it is not universal in nature. However, there's one element or one image that I will discuss with you, and I have discussed in the past in a video on ethnic rhinoplasty, that I think is helpful to communicate to you as a prospective patient or someone interested in ethnic rhinoplasty to understand how I deliver on it. So I call it the tent pole analogy. So if you think of a teepee or a tent pole, the teepee has a fabric on the outside and then it has the poles on the inside. So the poles inside represent the cartilage or the bone structure. And we're going to say cartilage because most of the lower two-thirds of the nose is cartilage, and that's what you're really reshaping. And the bones are oftentimes very similar in nature anyways across many of the ethnicities. But the cartilage is the inside of the tent poles, and the fabric outside is the skin. So to use that analogy, in a standard Caucasian or white rhinoplasty, the fabric on the outside is very, very thin or thinner. Sometimes it's thick, but for the sake of argument here, it's oftentimes thinner. And then the tent poles inside are very strong. So when you can easily reshape the poles inside, and you can see through that fabric the result. But the exact opposite is the case in an ethnic nose, where if you try to over-shave down the inner cartilage, the problem is that outer thick fabric never sits down on it, and it weakens the whole framework. So the whole thing sort of mushes or collapses. So you can build up actually more scar tissue and have a worse result. I remember very clearly about 5 years ago, this Hispanic lady came into me who had her rhinoplasty done in El Paso and said, "Why does my nose look bigger now after my surgery instead of smaller?" And so I did a little scar dissolve and her nose got better, but it's because the doctor over-reduced the cartilage inside. So a technique that I do for these thick skin, inside flimsy tent poles is, instead of weakening the tent poles by shaving down the cartilage and refining the inside of the nose, I actually push those poles out to create better structure to push through the push through the thick skin or thick fabric. So you want to thicken those poles. Now, if you did that in someone with very thin skin and you push those poles out with huge grafts, those grafts will show up over time. So you don't want to do that in someone with very thin skin. But if you have someone with very weak poles or weak cartilage inside, and you try to over-resect it, and you're going to lead to a lot of scar tissue inside the nose. That's not outside. I'm not talking about an external scar. I'm talking about just collagen scar tissue that builds up between the skin and the cartilage, which will then oftentimes make the skin actually thicker, the tip bigger, and you get the exact opposite result that you wanted. So this analogy of the tent poles or teepee is one mechanism by which I explain to patients about the difference between an ethnic rhinoplasty and a Caucasian rhinoplasty and how I approach those patients differently.